Introduce Toby Chanin from Liverpool University Hospital. He's going to talk to us a little bit about piloting a fully immersive regional simulation teaching course for dental core trainees.
Hi guys, thanks for staying and listening to me. So like I said, my name's Toby. I'm one of the clinical simulation fellows at AINTREE University Hospital, which has recently joined with another large central university hospital in Liverpool to become Liverpool University Hospitals. And that's our sort of slightly grim-looking building. So I'm going to talk to you about a dental simulation course that we ran and why it's kind of interesting to talk about. So I'll tell you a bit about who we are and what facilities we have there, what we were actually asked to do, and then why it was challenging and what we delivered at the end of it all. So this is our setup. I'm sure it's very similar to everybody else's setup. So in terms of, we've just got a single sim suite with a two-way mirror, and we've got a few different mannequins that we can access. And in terms of staff, we've got two clinical simulation fellows with both anaesthetics and ITU as background. It's quite anaesthetic heavy because we also have one full-time clinical educator who has a PICU background, so it's quite anaesthetic heavy, like I said, and a single part-time technician. We do have a few, we're connected to a clinical education centre as well, which runs ALS courses and clinical skills, but we solely focus on simulation. We're connected to a major trauma centre, which has also lots of tertiary services. So lots of our consultants, lots of our subject matter experts all come from the consultant group at that hospital. And these are the kind of courses we have experience running in. So we run things from medical student sort of undergraduate programs. We run theory and patient courses for doctors and nurses to run together. So it's kind of MDT debriefing. Anaesthetic courses, obviously, because we're all anaesthetists. Core medical trainee courses. We've also done things for physios, so getting non sort of healthcare professional groups that we're not used to coming in and actually running simulations and designing scenarios and courses, which is kind of a different experience. So, because you're not sure yourself what everything is and what they usually do. We also run trauma courses for our own trauma teams. So again, having lots of different levels on the ADPs and lots of MDT kind of debriefing and things. And then some in situ stuff. So this is our in situ with one of the Athena models. So what we were asked to do, so we were asked to prepare a course for dental core trainees before they started working, or just as they started working in hospital. And we knew we wouldn't have very many candidates. So in terms of the actual challenges that this presented us, I had no idea what a dental core trainee was, what they did, what they were expected to do on the wards. We've never run a course for it in the sort of 10, 15 years our sim centre's been running, and I didn't know anyone else who'd run one, and I couldn't really find any literature on it in terms of anybody else who'd done something similar. So if anyone else has in the room done something similar, then I apologise, I didn't find your stuff, but it seems to be something that not many people had designed a course for before. We also didn't have very long to design it. They wanted to start it quite quickly. They wanted to start it at the start of their rotations, so that it was actually something that was useful for them going forward. So we kind of deconstructed the problem into two parts. We did the first part was to try and figure out what this group of healthcare professionals were, what they were expected to do, what kind of areas they'd work in, and where they'd be likely to do their skills, and what skills they sort of had to begin with as well. And then design some scenarios that would, like any simulation, be realistic and be sort of learning outcome based. So the things that how we found out what dental core trainees are is actually we found a few different sources. So we had some of our own MaxFax consultants, but the training program has changed since they trained, and their training is quite complicated. So some of them, in order to become a consultant in MaxFax, you need to have a medical degree and a dental degree. Whereas a lot of these dental core trainees don't have that medical degree yet, they only have the dental degree. We also found a curriculum for them, so things that they needed to get out of their year's training. And what I found really useful is actually a day in the life accounts written by dental core trainees. So they would explain genuinely what they were expected to do, what they were doing on the wards and things. So who are they? They've completed a 5-year dentistry degree, which is mostly manual dexterity and skill based. So they come out of it expecting to do fillings and sort of repair teeth on a day-to-day basis. There's very little simulation. There's a lot of clinical skill simulation. There's very little actual sort of deteriorating sick patient simulation, and not very much focus on an A2E assessment. They will have also done a dental foundation training year, which is a 1-year post, mostly in general practice, getting them to become sort of independent at the skills they've already learned at university. And then this dental core training program is a 3-year training program where the idea is they're trying to gain more experience in oral surgery with the potential view of becoming maxillofacial surgeons, inevitably. And most of them won't have ever been in simulation. Most of them won't have ever been in a hospital post before. Most of them probably won't have seen wards or necessarily sick patients. But the expectations of them are actually fairly high in comparison. So the responsibilities, they'll assist in oral surgeries, so that's what they're there for. They'll attend clinics, they'll look after post-op ward patients, they'll do on-call shifts, so days, nights, weekends when supervision and extra help are not always around. They'll also see patients in emergency departments, and that's adults and paediatric cases, and they'll discharge patients. So you can kind of see how they're equivalent to essentially a surgical SHO but just specialising in max fax. So you could reasonably expect them actually to see quite sick patients, have to deal with some fairly urgent situations, and yet they've had almost no hospital experience and almost no simulation training whatsoever. So it makes them quite an odd group to design things for, because if you design things for nurses, if you worked in a hospital environment, you know what nurses on the whole do, you know what physios on the whole do. But these guys are actually sort of a complete mystery, or were a complete mystery, and they actually have quite a lot of responsibility and not very much training in it. So this is kind of my little story. So I think you're basically going from a dentist chair and then seeing someone in A&E with a dental abscess who maybe can't open their mouth or can only open their mouth a centimetre. So I've got no oral route, are in loads of pain, need IV antibiotics. They prescribe some IV antibiotics, walk away thinking that case is done, and they're called back and they see anaphylaxis and would be expected reasonably by their nursing colleagues to actually have to deal with that, and don't have any of the skills to deal with that, which is quite a lot to ask of somebody who, they're very skilled at what they do. They've spent a long time gaining those skills, but they're just not necessarily the ones that they need in this situation. So in terms of designing the course, we thought we needed to focus on actual quite basic stuff. So basically F1 level stuff, something that's quite equivalent to that. Like I said, most of them haven't done simulation training before, and when we surveyed them afterwards, only 50% of them have actually ever been in simulation. And although most of that will be very small scale, I think. So they're not used to doing that A2E. A lot of them won't have worked in teams. As you can imagine, I think dentistry is a fairly sole operator process. You do have a dental nurse who assists you with some things, but again, it's a very surgical-based team. It's not really sort of an urgent met team kind of idea, which is something that they would actually need to. It's another skill they need to learn. So we wanted to focus not just on dental scenarios as well, so not just dental abscess and things like that, but also generic emergencies that they would have to come across. And we were hoping at the end of it they'd feel more prepared to actually deal with these emergencies, and they would be able to utilise their team a bit more. So, working with the nurses, working with other healthcare professionals that turn up to these emergencies, and also that they knew how to call for help, because again, that's actually quite a skill in hospital. It's not always as obvious. I'm sure you've all seen medical students in your scenarios try and call for help, and they don't know how to work switchboard, or they ask for certain things. So actually that's a skill that they will need to know as well. So the scenarios we designed a mix of settings. So we had some post-op settings, some ward settings, and also some settings in ED. We wanted to be very clear about the learning objectives and also clarify debrief points. So we worked with one of the MaxFax consultants. He was going to be our subject matter expert to design those scenarios. So we ended up doing 7. So we did a full day of simulation. We started with an introductory session, sort of an introduction to simulation of the mannequin, because again, lots of them won't have ever done that. And we did a sepsis, a post-op hemorrhage, an anaphylaxis, sedation, low GCS. So again, that's something you're kind of going to see post-op. Cardiac arrest, a blocked tracheostomy, as a lot of their patients are also on the ward with a lot of ENT patients as well. So that's some of the core work they might be expected to see. And a carotid blowout, which is a specific thing that they are going to be called to A&E for. And this is an example of our design. So we were very clear about, so all the red parts are things that we want them to achieve during this scenario. So we want them to recognise that, the connection between antibiotics and the situation now, and the fact that any previous reactions. And we've kind of, again, gone through and picked out points at which, if they're not doing what they need to do, we push them down certain ways. So it helps with facilitation. And then being quite definitive about what we want to say in the debrief, because we want them all to come away from this experience having those specific debrief points, so they know where the algorithms are, they know how to call for help, they know that actually when you've got an anaphylaxis you probably need an anaesthetist, and what the MET team. So at our hospital we'd have cardiac arrest teams, we'd have MET teams, and that's something that, because this is a regional course, they'll also have to know that in their hospital they might call a cardiac arrest team rather than a MET team, and know the difference between those things as well. And this is just a picture of our setup. So this is what they'll see from the debrief room for those who aren't actually in the scenarios. And in terms of the feedback, it was actually fairly good. So they highlighted quite a few things. So again, we wanted to try and achieve them feeling more prepared from this course. And I think we managed to do that. So again, the debriefs they thought were important. Actually practicing the skills, the simulations. So again, something they hadn't done before. They've not practiced these skills before. I think some of these are important. So what we asked them what they would change in their practice. So more strategic handling of situations I thought was quite important, because that means hopefully they'll be able to utilise their teams a bit better. They'll be able to have an idea of who to call and when to call as well. And they feel more prepared. So it was actually rated fairly well in terms of their feedback. And in future directions, so we plan to run this course again, and we're hoping to get because it's the first time we've ever run it, we're hoping to get some of those original candidates back and just have a look at the program again and say, look, did this meet what you were expecting? Did you actually get some of these emergencies? Did you get anything that we didn't do? Was there something that actually would have been really useful that we could simulate? And then hopefully we can design a course that continues to improve, essentially. And that was it. Brilliant.
Thank you so much.
Thanks very much.